Social media is a large part of just about everyone's life, whether we like it or not. Facebook, Twitter, Instagram, they allow family, friends, and even strangers to get a glimpse into our lives. Scientists are scrambling to understand the effects of social media. As Christina Verjeko explains, some find it harmful, and others say it has the potential to provide life-changing help.
More than 16 million American adults suffer from at least one major depressive disorder. In a lot of those cases, their loved ones have no idea. For example, take the story of Madison Holleran. Her Instagram feed is full of pictures with friends and smiles. Yet, take a look at this. This is the last picture she posted, and this was 1 hour before she took her own life. This case proved how hard depression can be to spot, but new research suggests that social media can prove to be a life-saving tool, as it can give invaluable clues into one's mental health state. One picture, one thought at a time. The world practically runs off social media. Everywhere you go, heads are buried in phones, and for the medical community, this is uncharted territory.
This is very new. There's many studies happening now looking at these things. But what the actual effect is, we do not know.
Dr. Jason Parker is a senior psychology lecturer for Old Dominion University. Parker says social media can cause an addiction similar to the one associated with alcohol and even drugs.
The thing that makes it look like an addiction is they get anxiety when they don't have it.
Anxiety that could lead to long-term damage to emotions, especially for those already prone to depression.
You look out for stimulation that actually will make you sad, as in they're drawn to it.
Think of it as a vicious cycle. The information you might seek out on Google will fuel your feed on Facebook, while one like of a group, a meme, or any other post will bring up hundreds of others just like it.
So you're getting this whole kind of bombardment, potentially, of negative information to pull you down.
But some say social media can also be used to expose the struggles, if you know what to look for. Chris Danforth is an associate professor of mathematics and statistics at the University of Vermont. Along with a colleague, he recruited 166 people to share their Instagram accounts. Out of those, 71 had a clinical diagnosis of depression.
We compared pictures that they had taken and posted to Instagram with a population of individuals who were healthy, and then looked for differences between those pictures posted by the two groups.
44,000 photos later, the results showed that people who were depressed tended to post pictures more blue, darker, and grayer in color. They also showed less faces.
There could be predictive information in things like the pictures we post to Instagram that could be leveraged by an algorithm to get you in front of a doctor sooner.
Danforth admits that there's a lot more work that needs to be done. The study is a start, proving that cell phones that are glued to so many people's hands could give insight into one's mental health state. But doctors still agree that for outsiders, recognizing that their friends and loved ones are in emotional trouble isn't always easy.
The biggest dangers in depression is people actually hide it. So you see this wonderful smile on their face, and you had no idea, that they're actually depressed and have suffered their whole lives.